Hi guys, come with me. We're going to do our first antenatal visit at Melomed Bellville. Dr. Masina's already there. Let's go.
Now we are moving on. We are having our next speaker. It's a collaboration. We've got Dr. Isaacs from Melomed Bellville, and then we've got Dr. Masina from Melomed Play. So over to you.
All right, while they're getting the presentation ready. Hi, I'm Dr. Isaac. Some of you know me. I see some familiar faces in the crowd. I am one of the obstetricians and gynecologists that work here at Melomed Bellville. So that's Dr. Masina over there, and the two of us. Okay. The two of us have recently started our own podcast. It's called ziRight Girl. Some of you would have gotten the QR code. So at the end of this, the podcast is basically all about gynae and things that women should know without having to study to become gynecologists in order to know about it, right? So we talk about everything there that we think is important for women to know about themselves and their bodies, right? So you would have received a little QR code. It's the same like that. So we're going to do a little giveaway at the end of our talks. You can scan that QR code over there. It'll take you right to our YouTube website. And if you find, I think it's episode 3, it's our episode on pregnancy and pregnancy care. If you can like and subscribe on that, and then I think the word we're using today is the word baby. If you put baby in the comments, you will then be automatically entered into our lucky draw. So we have 3 prizes that we're giving away at the end of this talk. All right.
Good morning. ziRight girls?
ziRight.
And the daddies, are they also okay? Okay. I'm Dr. Masina, and I'll be talking about postnatal care, which basically is the rest of your life after you've had a baby. But I'll be just talking about the immediate postpartum. So, postnatal care is the care that is given to the mother and the newborn immediately after birth and up to 6 weeks or 42 days after delivery. The importance, obviously, is to prevent complications, promote bonding, and ensures a safe recovery for both you and baby. The objective of postnatal care is to promote physical and emotional recovery for the mother, support breastfeeding and newborn care, detect and manage complications early, and family planning. So maternal care, immediately we need to look out for physiological changes. You know that immediately after giving birth, there will be some further uterine contractions as your womb tries to contract and go back to its normal size. So with the involution of the uterus, there's an injection of blood back into your bloodstream. And also there's like a withdrawal of hormones once the placenta is out. And that's why most mothers would sort of like feel very tired after giving birth. So it's like a crash in your system. We monitor for postpartum hemorrhage. Postpartum hemorrhage is excessive bleeding after delivery. So this is very important because postpartum hemorrhage, unfortunately, it's still a leading cause of maternal death. So you heard Dr. Isaacs talking about how we are always on the lookout for anemia, and we need to adequately treat anemia because with delivery, we know there is some expected blood loss. And again, with poorly treated anemia, there is a higher risk of postpartum hemorrhage, which can have catastrophic effects at delivery. We need to support the mother and make sure that they also get enough rest. And now this is where the daddies need to shine. Mommy has been carrying the baby for the last 9 months, so the daddies also need to get involved in the baby care and maternal care as well. We support breastfeeding. And how do we support breastfeeding? We make sure that mommy is well hydrated. We make sure that the environment that mommy is sitting in is much comfortable for mommy to be able to breastfeed. We support her with pillows. We support her with providing things like nipple creams. And breastfeeding is also something that is quite painful. It's actually a skill, something that a lot of new mummies get quite shocked that, oh, I thought you deliver, the baby latches, and life goes on. Unfortunately, it is much more difficult than we anticipate. So we need a mother that is willing and also that understands that breastfeeding is a skill. You need to be willing to learn and be supported. Some people feel it's quite invasive and it's quite demanding on the body as well. I mean, if you have a breastfeeding baby, you literally, this baby's breakfast, lunch, and dinner, and the baby needs to be attached to you 24/7. Nobody else can comfort that baby. Nobody else can feed that baby except you. But you can pump and other people can assist you with feeding. So at least you can go and have a shower, because unfortunately the minute you get up, the baby cries. Pain management. So pain management in the postpartum period is quite important, because there's a lot of things that are painful. You've just given birth. The uterus is contracting. Just when you thought that the contractions from labor are finished, wait, there's more. As the baby breastfeeds, there's further release of oxytocin. There's more contractions, so it's quite uncomfortable. Like I explained, that breastfeeding can be quite painful. The nipples can be quite tender, so you can be like walking around feeling very ouchy. So pain management is also needed for that. Perineal care. Some women, there will be some injury to your birth canal. So there will be some bruising, some tearing. Some people even get lacerations that need stitches. Sometimes you get an episiotomy. So that can be quite painful. So you need adequate pain management. And this again comes in many forms, because now remember, as well as now baby is out, but you're still breastfeeding. So the medication, whatever medication that you use, can be passed onto the breast milk. And also you need to be alert. So you need to be aware of the medication that you use, if it's not going to make you drowsy, because you may not hear baby cry and you'll wake up the next day and baby will be dry and dehydrated, you know. So pain management, it's not always drug management. Sometimes it's just supportive things. So things like the saltwater bath, like a warm bath, is quite comforting. So for the perineal pain, that helps quite a lot. Cabbage leaves for painful breast and engorgement, and things like that. If you have a C-section as well, there's quite significant amount of pain. It's a major abdominal procedure, so you need walking aids, you need support, you need proper medication for that. Okay, so danger signs. Again, heavy bleeding being number one. You do expect some bleeding after delivery. It can be like a period, but obviously if it's like heavy with clots and you're constantly changing pads, that is dangerous. If you have a fever in the immediate postpartum, that it could be a sign of infection, so do check it out, don't ignore it. There are a lot of things that could cause infection. So again, breastfeeding mastitis, which is inflammation of the breast. If you've had any lacerations or any stitches in your perineum, that could also get infected. We have been examining you during labor. That could also introduce infection to the womb. So a fever is always a danger sign. Or sometimes it could just be normal upper respiratory tract infection, a flu. But a fever is always a danger sign, and always have it assessed to make sure you know what it's where it's coming from. A foul-smelling discharge, so again, could be a sign of infection of the lining of the womb. A severe headache. The physio mentioned quite a bit about preeclampsia during pregnancy. Unfortunately, preeclampsia can also happen after delivery, especially in the first week. So if you start suddenly experiencing severe headache, and convulsions. It could still be preeclampsia, so do get that checked out. The baby, often babies are always hungry. That's also what surprises breastfeeding moms. Like, it's like I'm not producing enough. This baby always wants to feed. But the feeding is good because it stimulates milk production, it promotes bonding, it keeps baby hydrated. And their stomachs are tiny, so obviously they will feed frequently rather than like drink 200 mils of milk and lay there for the next 4 hours. But a baby that feeds poorly is a danger sign. Difficulty in breathing, a baby that feels hot or cold and clammy. Often babies can feel more cold than hot. A baby that develops jaundice. So yes, sometimes you can have normal jaundice. However, you can only be sure that it's not jaundice that you need to be concerned about once the bilirubin levels have been checked out. So do consult your midwife or your pediatrician if you notice that baby has jaundice. Convulsions in the baby as well, or a baby that's usually we say listless or just pop, baby usually has tone. So if a baby feels a little bit floppy and weak, always consult. So who provides this care? Your midwife is a great support in the postnatal period. Your obstetrician, so we don't sever the relationship once the baby is out. If you can, get a doula. So doulas, again, are birth partners that are not midwives. They are not doctors. It's more a social birth partner that can assist you. And they're quite knowledgeable about a lot of antenatal and postnatal conditions, and they can guide you as well, what looks dangerous, what is normal, and they're quite a good support system. They can be hired, so if you can afford one, it would be nice to invest in one. Primary healthcare facilities, so if you're in the state sector, usually they would have like a 3-day visit or a 7-day visit, and that's where you have to ask all your questions or raise up your concerns. So your visits, usually in the first 24 hours, most of you would be still in hospital up to 48 hours. Then in the third visit, 7 to 14 days, again, because that's when you would pick up the infections. Again, it's a check-in, how the first week is going, any concerns. The fourth visit is at 6 weeks, and then again at 6 weeks, we're checking if there are any complications that are still persisting from pregnancy, things like backache, things like perineal trauma, if it's resolving or it has resolved, any ongoing concerns, and we also address your birth control. So common conditions, I've already briefly touched on breast engorgement. So often the milk comes in day 2 to 3. It comes in a lot, but when the breasts are engorged, they are rock hard and they are painful. Cracked nipples are common as well. That's often a sign of a poor latching technique. So like I said, breastfeeding is a skill, and if you don't get it right, unfortunately it can result in cracked nipples, which can then lead to mastitis. Mastitis is when the breast is now infected, and you'd see this with redness. Sometimes there may be even abscesses and pus. So how do you treat breast engorgement and breast engorgement mainly? Frequent feeding, pumping, so that you don't have large and full breasts. Obviously, you need assistance with the latching technique. There's often breastfeeding technicians or people who assist with latching, even your midwives in the ward. If you've got pain, anti-inflammatories. If you've got infection, antibiotics can be safe. Nipple cream or lanolin ointment for cracked nipples to keep the breast moisturized. You can even use breast milk, however, then you may just smell very milky. Don't think that even matters because you're always feeding anyway. So as you can see there's the breast lobules, the milk ducts. So sometimes there's a blockage there if the milk is not coming through the milk ducts, and then it backs up, and you can see in the bottom one where there's like little lumps of milk collecting there. So other common conditions, swollen legs. The most common reason why your legs swell is physiological, meaning it's normal. So during pregnancy, you accumulate a lot of fluid, and after delivery, this fluid then goes back into your bloodstream, and some of it will seep into your, we call it the third space, and you may develop swollen legs. The swollen legs, the physio mentioned about it pitting or leaving a dent on your legs. So if you've got swelling, there will be some form of dent. But I always say swollen legs that are accompanied by other signs. So if the swollen leg is associated with pain, if it's only on one side, if it's associated with a headache, because again, then that may be preeclampsia. If you've got difficulty breathing, because then that could be a sign of excessive fluid accumulation, including in your heart, in your lungs. Shortness of breath when lying down, that could be sign of heart failure. Treatment, most of the time, just leg elevation. So although you're not supposed to be completely not active, when you are sitting down, avoid having your legs hang. Compression stockings, these again help your calf muscles to pump and prevent clot formation in your legs, and they don't make the swelling worse. Then we also need to look after your mental health. There's sometimes baby blues, which are quite common. They are often normal. So usually they say the tears come down with the coming in of the milk. So the milk comes in day 2 to 3. You may start experiencing, you're very emotional, very teary, but you often get out of it within the first week or 2. Things to be concerned about. If you are excessively teary, you're crying over everything, you're feeling overwhelmed and anxious, you are irritable, there's changes in your appetite and you don't feel like eating, poor self-care or newborn neglect, sleeplessness, so you're not sleeping at all or you are oversleeping. Those are signs of overt depression. So do discuss this, especially in your 1 to 2 week appointment. So if you're feeling, even if you just want to check in, is this normal, why I'm feeling this way? So because postnatal depression unfortunately is a thing, and you are at high risk if you've had pre-existing depression, also with sleep deprivation, lack of social support. We now live in islands, we don't have our community anymore, you don't move back to your mother's house when you give birth. That can be quite isolating. So that can lead you to postnatal depression. Also, sometimes there's stressful life events that happen during pregnancy or during or after childbirth, and that can lead to postnatal depression. Treatment, again, speaking about it to whoever is able to listen, refer you to the relevant help. You can get psychotherapy, which is basically your psychologist or your lay counselor. You can get medication if you are clinically depressed. Antidepressants, I know again there's a concern about mothers who are taking medication while they are breastfeeding. However, I would rather have a well mommy that can look after her baby than a depressed mommy that is trying by all means to survive and breastfeed and take care of a newborn. So discuss this with your carer or provider so that you choose the medication that is less toxic or has a less bad effect on breast milk. Social support. So again, you need social support to survive in life. Doesn't matter where you are. Like I said, postpartum is literally the rest of your life after having a baby. I'm here, I'm 13 years postpartum. Hey. And then family planning. Family planning is something that should be discussed antenatally as well as postnatally. Maybe after you've had the baby, then now you have a better idea of what it's like to be a parent and you can then reevaluate your ambitions. Often the first time they say, oh, we want 5 kids, and then after the first week visit, they're like, oh no, I think I'm fine. The mother is fine. The dad is like, okay, maybe one more. So we plan how we're going to space our babies. We plan what we're going to use. And family planning is not one size fits all. So we all sitting here, we all have different wishes, we all have different bodies, we all respond differently to different medications. So it depends on all of those things. Do discuss the most appropriate method for you. And when you've completed your family, non-hormonal methods are preferred and permanent methods are preferred. Sterilization for the woman. Vasectomy is a very good permanent family planning. It's a minor procedure, often minimal complications, and it's less dangerous. So the daddies can also have a role in this. Physical activity. Physio has already touched a bit about this. So during pregnancy, we always encourage physical activity, postpartum, light exercise, and you gradually increase as the aches and pains also improve. So as you are still recovering from delivery, when you're sitting, circling your ankles improves circulation. Pelvic floor muscle rehabilitation, she touched a bit on that. You guys did some exercises, so we continue. And rebuilding your abdominal muscle, she touched on rectus diastasis. Most of the time, there will be some form of separation of your abdominal muscles. Even if you didn't have a six-pack before, growing a belly, a uterus underneath that's going to stretch your muscles, there will be some separation. And sexual intercourse. So sexual intercourse, again, we do it when the woman feels ready. Usually after 6 weeks, the woman has healed physically, but she must both be physically and mentally ready. Also, we have already discussed contraception, and it should feel safe for the mom to continue. So the reason we wait 6 weeks is because we've spoken about perineal injuries that can happen during birth and delivery. Obviously, the uterus has been open, and there's a risk of ascending infection, so you want to avoid complications if you're going to have intercourse too early, so rather wait the entire 6 weeks. So in conclusion, the postnatal period is up to 6 weeks, but generally is longer because most people who have had babies before will tell you that it takes longer than that to almost feel like your normal self again. It's at least probably the first year after delivery, you don't feel completely like your normal self. So be kind to yourself, be kind to your body, and take it as each day as it comes. You need a lot of psychosocial support for mom and baby to be healthy. So it's a roller coaster, but enjoy the ride. Thank you.
So let's talk about what you guys are winning. We've put together a postpartum pack. So we always get stuff for the babies. Like everyone is giving us growers and nappies, and so these are for the moms. It's purely for the moms. If you want to share with other people, do so. If you don't, it's also fine. Okay, so the first winner, congratulations to Jamie Snell. You want to give me one of those?
Which one?
That one.
Thank you. Congratulations.
All right. Congratulations, Jamie. Our next winner is Refilwe Nkosi. No? Congratulations.
Congratulations.
Congratulations. Ooh, Canada. All right. And then we have one more prize.
Is this the grand prize?
Congratulations.
Did you manage to enter?
Msindi Sambane. Am I saying your name correctly? Oh, okay.
Is it this one?
So the rule I said about not sharing does not apply here, no? Congratulations, Dad. Congrats.
Thank you.
Okay, thank you, ladies and gentlemen. We hope that you have a wonderful pregnancy journey and a healthy and happy postpartum period as well. Enjoy. Congratulations to all of you.
There you have it, guys. Thank you for joining us at our talk at the antenatal class at Melomed Bellville. We hope that this talk has been informative, and we hope
ziRight
girls.